friends, once again a warm welcome to my YouTube channel Future Midwife. Today's our topic is multiple gestation. Multiple gestation, also known as multiple pregnancy, which occurs when a woman carries more than one fetus during her pregnancy. This can include twins, triplets, quadruplets, and higher order of multiples. Its prevalence is increasing due to medical advancement and delayed childbearing. Specialized medical management is crucial for optimal outcomes. Here we can discuss about different types of multiple gestation. First we will categorize according to the epidemiology. The first one is dizygotic twins. It is otherwise called fraternal twins, which develop from two separate eggs, each fertilized by a different sperm. The second one is monozygotic twins, which is otherwise called identical twins, which develop from a single fertilized egg that splits and forms two embryo. Next category is based on the chorionicity and amnioticity. The first one is Dichorionic-diamniotic twins. Each twins have its own placenta and amniotic sac. The second one is Monochorionic-diamniotic twins. Twins share a placenta but have separate amniotic sac. The third one is Monochorionic-monoamniotic twins. Twins shares both a placenta and an amniotic sac. For triplets and higher order multiples, the types can be more complex, which include Trizygotic triplets. In this case, which develop from three separate eggs, each fertilized by a different sperm. The other category is Dizygotic and Monozygotic triplets, which is the combination of fraternal and identical triplets. So these are the different category of multiple gestation. Each types of multiple gestation has its own unique characteristics and potential complications. Here we can move on to diagnosis and monitoring of multiple gestation. Early diagnosis is crucial for multiple gestation. Ongoing monitoring ensures maternal and fetal well-being. Regular checks helps identify and manage potential issues. In that, first one is early ultrasound. It helps to confirm the number of fetus and also determine the chorionicity. Next, the mother has to undergo frequent prenatal visit, which helps to monitor maternal and fetal health closely. Also, it allows for timely interventions. Next is the cervical length screening. It helps to assess the risk of preterm labor. A short cervix indicates higher risk. Next one is fetal health assessment, which include echocardiography and non-stress test. Evaluate for heart defect and overall health. Here I will explain about the main system-wise maternal physiological adaptations which happen during multiple gestation. The first one is cardiovascular system. Blood volume increase by 50 to 60%. In case of respiratory system, which increase dyspnea due to elevated diaphragm. In case of gastrointestinal system, exacerbated nausea, vomiting and heartburn can be occurs. In case of nutritional requirement, the mother should take at least 600 to 1000 kilocalorie per day as extra. High iron and folate also needed. Here we reach the maternal risk and complications of multiple gestation. First one is preterm labor and birth. Over 50% of teen pregnancies deliver early. Next is the hypertensive disorder. Preeclampsia risk is 2 to 3 times higher than the normal pregnancy. Third one is gestational diabetes. Incidence is 2 times higher than the normal pregnancy. Iron deficiency anemia also common during multiple gestation. Next one is the postpartum hemorrhage. Uterine atony risk is 2 to 4 times higher than the normal pregnancies. So these are the few maternal risk and complications due to multiple gestation. Here I will explain about the fetal or neonatal risk and complications. In that, first one is preterm birth. Preterm birth will be the leading cause of morbidity and mortality. Usually in case of multiple gestation, the baby will be born with a low birth weight. Growth retardation also will be a common complication in case of multiple gestation. Twin-to-twin transfusion syndrome can be expected around 10 to 15% of monochorionic and diamniotic twin cases. So these are the fetal or neonatal risk and complications of multiple gestation. Here we reach the management and care aspect of multiple gestation. Management of multiple gestation involves careful monitoring and specialized care to minimize risk and ensure the best possible outcome for both mother and babies. In that, first one is nutritional support. Increased caloric and nutrient intake is vital. An additional 300 calories per fetus per day is needed. Next will be the preterm labor prevention. In that, cervical circlage and progesterone may be considered. Antenatal corticosteroid accelerate lung maturity. Next one will be the fetal neuroprotection. Magnesium sulfate given for preterm infants. It protects the developing brain. Last one is delivery planning. Time and mode depend on various factors. Vaginal delivery is possible for some twins. Here we reach the delivery planning. Delivery planning in case of multiple gestation is based on the following conditions. In that, first one is delivery timing. Planning delivery at the optimal gestational age, balancing the risk of preterm birth against the risk of continuing the pregnancy. The second one is delivery mode. Deciding on the mode of delivery, considering factors such as fetal presentation, gestational age, and maternal health. And the next factor will be the neonatal care. Preparing for potential neonatal complication and ensuring the availability of specialized care. Here I will explain about the delivery consideration on the basis of type of twin, delivery timing, and common mode of delivery. In that, first one is dizygotic twins. In case of dizygotic twins, the delivery timing will be 37 weeks to 37 weeks plus 6 days. In this case, vaginal or cesarean section will be possible. In case of monoamniotic and dichorionic twins, the best possible delivery timing will be 34 weeks to 37 weeks plus 6 days. In this case also, vaginal delivery or cesarean section will be possible. But in case of monoamniotic twins, the best possible timing will be 32 weeks to 33 weeks plus 6 days. Here only the cesarean section will be possible as a mode of delivery. This overview provides a general framework for managing multiple gestation. However, each pregnancy is unique and management plan should be tailored to individual needs and circumstances. Without antenatal, intranatal and postpartum care, the multiple gestation explanation will not be complete. So, these will be displayed on the screen. Please have a look on it. So, in the next class, we will meet with another episode of midwifery topic. Till that, take care. Bye-bye.